Healthcare is at the brink of a massive transformation. Over the last 10 years, the industry has spent billions of dollars in digitizing healthcare processes with great success. That was step number one of the journey. Now, we have troves of information on our health locked in electronic silos. Without a complete patient picture, gaps in care, gaps in communication, medication use, referrals, and the entire care experience can fall apart. We need to bring this information together using a cloud platform that not only unlocks the power of the data, but also provides a platform on which new digital services and solutions can be built with native interoperability. And this is where Innovacer comes in. With the Innovacer Health Cloud, we deliver the missing pieces required to build the future of health, including a cloud-native data activation platform that acquires, aggregates, and normalizes clinical, claims, lab, and other healthcare data across systems and settings, giving providers and other stakeholders a 360-degree view of patients and their care journey.
Hear in their own words why they should win.
Healthcare data models are broken, keeping vital information siloed across the digital ecosystem. A breakthrough is needed. That's why the Innovacer Health Cloud is accelerating innovation of healthcare, and it's all powered by our best-in-class data activation platform.
We are building a platform. A lot of different people can basically come and really start building new tools and technologies for caregivers, for patients, for everyone who is in the continuum of care.
This platform brings together multiple data sources to create a unified patient record, leveraging plug-and-play data integration pre-built for most health IT systems and vendors.
Innovacer has been able to create what I would call liquidity of healthcare data.
Innovacer is able to aggregate the claims data and process it immediately and make it available to the physician with the patient and the patient's family in front of the physician. And not only have it available, but have it put onto the same screen that the physician is looking at the time he's looking at the healthcare delivery data.
Innovacer moves beyond silos to create a completely open and secure platform, connecting and curating the world's healthcare data.
We have one platform that's meeting the needs of what required 3 or 4 platforms previously.
It's constant evolution because we're learning new things every day that we didn't know before, because now we have the data.
Experience the data activation platform that is accelerating innovation in healthcare at innovacer.com.
ThedaCare is transforming their health system into a population health company under the leadership of their CEO, Dr. Imran Andrabi. Heavily focused on accountable care, ThedaCare launched the Be Well solution under the brand Ripple, with a goal to automate care gap closure across their population of patients. Consumer activation workflows transform care by integrating consumer health data from both the health system and from outside providers, and combining it into one comprehensive but easy to understand view. Providing a health summary with well-defined care needs and next best actions. Leveraging analytics that trigger personalized engagement workflows that drive consumers to close specific gaps in care. And simple navigation to the most appropriate care setting, whether it's virtual, in-person, or digital therapeutics.
Hear in their own words why they should win.
BeWell's superpower is our relentless commitment to simplifying healthcare experiences for consumers, while also delivering value to our customers in their journey towards value-based care. We bring together a diverse workforce so that our platform will consistently represent all people. We're built on a foundation of real-time data authorized by consumers and integrated bidirectionally into today's core workflow systems like EMRs and payer systems. Our configurable workflows leverage this data and empower clients to deliver personalized messaging all the way down to an N of 1 without having to use our most precious resources, our doctors and our nurses, to pick up the phone. And our open API framework has the ability for fast auto onboarding of solution partners with recommendations to consumers to provide support in between doctors' visits. I believe we should win the UCSF Health Award because the future of health is collaborative, and it's going to require companies of all kinds to work together to deliver a combination of care that is in person, virtual, and digital. And it's going to require delivery of an all-in-one healthcare experience that consumers can trust. We offer the missing layer of infrastructure that makes this future a reality.
One of the first things she does is review those current medications with Lucy. And she starts with the Levemir, and they have a conversation about what would work for Lucy. They decide to go with the Lantus, and you can see that a PA is required. So in selecting the Lantus, we're going to power an EPA experience that immediately pulls back the question set required to get approval to Lantus. So Dr. Raja can go through, answer the questions, digitally sign, and submit that through in real time. When it can be approved, the answer or the approval will also come back in near real time. And so in this case, we got approval, everything's good to go. And if for some reason there was a denial, it would go off to the care team for further processing. So Lucy's all set to get her now Lantus with that PA covered. She also decided she did want to go downstairs to that health system pharmacy instead of her usual Walgreens. And so Dr. Raj is also going to go in and make that change on her Lysina Pro.
Hear in their own words why they should win.
Clinical decision-making has been disconnected from consumer choice. Purchasing decisions are made on behalf of patients without the ability to consider the most affordable or accessible option. That may have been okay when deductibles were low, formularies were simple, and the variability in drug pricing was in the tens of dollars. That's no longer the case. Deductibles are in the thousands. Patients bear the whole cost within those deductibles. Formularies are complex, and drug costs may vary hundreds and sometimes thousands of dollars. At Arrive Health, we're clearing the way for better health. That means enabling consumer choice, affordability, and access within the ordering workflows of providers. That also means empowering patients and their care teams to leverage real-time and patient-specific affordability options. We're approaching a run rate that will result in 100 million transactions a year. We have 150 million health plan members accessible in our network and more than 300,000 providers addressable in our network. We've established ourselves as a leader in point-of-care price transparency, but we're just getting started. Arrive Health is born out of the belief that all people deserve access to affordable and quality care, that no one should have to choose between managing their health and meeting their basic needs. Arrive Health's unwavering focus is to solve patient affordability issues, guide patients down a care path that results in less friction and lower overall costs, and empower providers and their care teams to be a part of that process from the outset. This all starts with the trust that exists between the patient and the provider. Empowering that inherent trust with the right information at the right time is how we are connecting consumer choice and clinical decision-making for the first time.
Omni is a new kind of site search that answers a customer's need, a want, or simply a question, and delivers the right care quickly and without frustration. It's easy to install, customizable, and provides customers with access to care from a single search bar located on any page. Omni fetches all your website's data and content and makes it indexable and searchable. As you update the site, Omni updates search results automatically. Finally, modern search has arrived to healthcare. Search literally anything and deliver a search experience that never leads to dead ends and keeps customers engaged. Search results are dynamic, personalized, relevant, and organized by providers with next available appointment or a location with same-day availability. Healthcare websites are dependably complex, as your customers must sift through an amazing number of options to find what they're looking for. Done right, Omni works like magic to pair customers with the right care. Search for providers, locations, and conditions, no matter the query, with just a click, Omni interprets intent and returns the care, the modality, and the experience that your customers want.
Hear in their own words why they should win.
DexCare is a platform for patient access, and one of the things that we pride ourselves in is making sure that we meet patients where they need to be met. Search engine where they start their search. We know that health system patients are not necessarily monogamous to their health system, especially when it comes to convenient care. So they usually start at something like Google or some other search engine, in which that we want to make a health system as performant as possible at the real front door at Google, using either using SEO and SEM strategies, as well as giving tools to the health system to be able to manage their ad spend and campaigns based off of their real capacity. So, for example, one thing that we can do is take the inventory data that we have, capacity data that we have, by when we connect into your EMR, and pull out that inventory for specific clinics or specific providers, that we can actually pause ad spend based off the inventory. So if right now a clinic was low on slots, then we can hide that ad and pause that ad, so you're not spending money on a actual an advertising or getting paid for click, when really there's no inventory to be sold. So one of the things that we do here is also make sure the health systems are set up from a Google My Business perspective very well, and they are one click away from Google. Every patient is one click away from Google to an ability to transact, and it can convert down the system. So for example, a patient here typed in urgent care or symptoms around urgent care, in which that they are presented with an ad, and then also some locations, and proximity usually wins when it comes down to healthcare locations. So we want to make sure that our virtual service has also got a GMB location within every area as well, so it can compete and be presented next to actual physical locations. And then we also have the traditional organic SEO results as well.
Hear in their own words why they should win.
Our healthcare journey started over 10 years ago with my daughter, Kate. At a young age, she was misdiagnosed, starting in triage in an emergency department, which led to complications from a cascade of human errors. Kate is okay now, but it was clear that the hardworking clinicians needed more support to deliver safe and effective care. That care is even more challenging now, as 70% of all admitted patients come in through the ED. Hospitals are now struggling with turnover, new to practice staff, and who are seeing an increasingly larger volume of complex patients. This is difficult to manage even for top performing hospitals. We turned that initial traumatic event around and created Mednician and Kate to help clinicians recognize risk, reduce bias and inequities, and amplify existing clinician capabilities, ultimately being better for patients, the nurses that care for them, and the hospitals that support them.
This is the perfect use case for clinical grade AI. Kate AI provides 24/7 real-time clinical guidance for emergency nurses. Kate's unique listening technology monitors nurse triage notes in real time, including a patient's medical history for each prediction. Kate understands all the clinical data, including unstructured free text notes. Kate is fully integrated with leading EHRs, providing nurses with accurate and timely notifications to help improve care for the patients in front of them. Kate is backed by peer-reviewed research. In a study of over 160,000 ED visits, Kate's accuracy was 93% higher than clinicians for high-risk patients. Kate helps clinicians save lives, improving patient outcomes and experience, staff well-being, and the reduction of the cost of care. Kate is loved by the nurses and viewed as a valued member of their team. Thank you for joining.
Hello, I'm Rick Renard, Partnership Lead at Able, and I'm going to tell you a bit more about why we are convinced that we should win the award. So the future of healthcare is more digital. The pandemic is accelerating this digitization. And the first wave in digital health was all about digitizing the consultation. But the digital health winners of today and tomorrow, they need to own the care flow end to end. So besides the teleconsultation, you have automated triage, medication flows, and much more. But the problem with owning this care flow end to end is that it takes a lot of time and a lot of investments. And the main reason is that clinical and product experts spend time mapping their flows in Miro, Word, Lucidchart, and then software engineers hard-code these flows into their patient and care team apps. And this results in time and resources lost to implement the V1, poor agility and speed to iterate, and waste in operation and clinical errors because the majority of the processes are still manual. And we are convinced that we solve this problem. Our software has been used to build and orchestrate care pathways for more than 20 customers. We have over 100,000 patients live on our platform in chronic pain, IBD, lung cancer, and much more. And we have data that shows that our platforms improves outcomes at lower cost. And the way that we do it is that we designed a no-code platform where clinical and experts can build and validate their care flows. And then the software engineers feed their patient and care team apps using APIs. This results in free up engineering resources, faster time to market, higher iteration frequency so they can improve, and then also an increase in operational and clinical excellence. And what we think is that the digital health winners of today and tomorrow will be the one that have an agile way to build, learn, and improve their care flows on a continuous way.
Over the years, there have been many approaches to building a layer of interoperability across the healthcare ecosystem. Fax machine empires, integration engine services, portal scrapers. Now that Particle has built the infrastructure, we're seeing a true network approach become possible. And today, Particle has connections with almost 300 million people's medical records through our API. So, how does it all work? Generally speaking, a customer interacts with our API by sending a set of demographics to search for. Particle packages this payload into network-compliant formats and distributes a search function using a proprietary logic-based record location service. Then we pass the payload to all the endpoints we think the patient may have been. The EMRs, or endpoints, then manage the matching on their end, erring on the side of safety by way of strict heuristics. When a match is found, the EMR will create and respond with a point-in-time document in the CCDA format to Particle. On average, Particle will find about 95 records per patient per search. We pull this data back into our system and do two things with it. Number one, we make the raw data available via our CCDA API. And number two, we parse, standardize, and convert all the CCDA to FHIR R4 and make it available through our FHIR API. Now that we hold the data, you can retrieve either the full CCDA or query for just the information you're looking for with FHIR parameters.
Hear in their own words why they should win.
Particle Health is a very simple API. You put in someone's name, date of birth, address, phone number, and we go collect all their medical records from around the United States. We parse them, we standardize them, we convert them to FHIR R4 to make it really easy for developers to use. We're plugged into most of the health information networks and EMRs around the US today. And on average, we find records 90% of the time through the API. We also find about 105 records per patient per search. So as we add and create a bigger network of networks, we are finding more pieces of that patient's longitudinal history that we can put together and deliver in minutes to our customers. I think we should win because we are taking a step beyond just data aggregation. Instead of just saying, here's all the data on the patient, go for it, we are working with our customers to develop curated data sets that support their clinical outcome goals. An example might be pulling GFRs and creatinines and serum albumins to look at renal disease and renal functions over time, allowing providers to have really good pictures of what's happening with this patient at the point of care. That allows the patient to make accurate, holistic decisions and drive better outcomes. Our superpower is the way we work with our customers. It's very differentiated in that from day one, we are talking and learning about your business use cases, your business problems, your clinical problems, and your technical hurdles that we have to get over. We develop really great implementation plans and really focus on that value element. How do we get to value fast? That is the major theme at Particle and the thing that we're most focused on. I'm really excited to be here, and thanks for having me.
It's indeed very difficult to reach a good balance between privacy and availability of data for research, and there are lots of issues. But I believe that if the patient is well aware of why the data is used and what for, how does Andamán 7 help with all of these problems? First, it's a personal health record for patients, so it allows everybody to take control of their health data for asking for a second advice, for example, to have your data when you travel. Just a simple example, on my smartphone I have my data, of course, and I have the data of my son. When I go to the doctor with my son, I can enter any important information in my smartphone. And this information is synchronized with my wife's smartphone, so when she goes to the doctor with my son, she has all the information available and she can enter information herself. So this is how Andamán works. It's a personal health record first, but with the capability to exchange data in a very secure way and always with the patient initiative, with the patient consent, if you want. So that's the first step. But Andamán is also a gateway to patients to allow hospitals or the medical research industry to get access to data and to exchange data with the patient. Of course, always with the patient consent. With this, I think we reach a right balance between privacy and the normal feeling of a patient that wants to be in control of their data and the availability of data for research. For example, in my own case, I agree to share my data with the medical research industry to find better cures for myself, for my family, and for other people with same conditions. So Andamán is a perfect tool for collecting medical data for individual use, but also to share it with the medical research community. And with that, we can collect real-world evidence in addition to medical data, patient-reported outcomes, and all kinds of questionnaires. So this is the real goal of Andamán: help the patient take control of their health and allow them to share the data with all actors in the medical sector. So let's all use Andamán 7 for reaching those two goals.
Wellbeing, providers can do away with the dreaded weekly stacks of faxed paper and electronically sign important post-acute orders, care plans, medication lists, and more. This can be done anytime, anywhere, and on the go using the mobile app. This reduces signature delays and provides more timely patient care, and signed orders are automatically uploaded into Epic, eliminating manual uploading by medical records teams. Via Wellbeam's instant messaging portal, providers can be notified by home health clinicians about critical concerns relating to patients. This includes wound issues, infections, abnormal vitals, drains and fluids, urgent labs, and more. It allows providers to receive photos taken by clinicians and respond with quick verbal orders, helping to keep patients progressing safely at home without a trip to the ER. With Wellbeam, providers also have greater visibility into patient care post-discharge. Agency partners remove the black box experience that providers frequently experience by updating patient status in Wellbeam across predetermined categories, including active, rehospitalized, readmitted to HHA, and discharged from HHA. Personalized updates can indicate if a patient has improved, worsened, or remained steady. Wellbeam's digital workflow improves post-acute clinical care outcomes, enhances staff utilization and productivity, and increases provider satisfaction.
Hear in their own words why they should win.
Hi, I'm Ami Dabani, and I'm the CEO and co-founder of a company called Wellbeam. Wellbeam was born out of physician and provider feedback and frustration with their clinical workflows with home health and SNF. They would tell us that they would do this involved care on the inpatient side, but after patients were discharged, they would often have no visibility into how those patients were doing, unless and until those patients bounced back as a readmission. Home health agencies and SNFs continue patient care after discharge, but oftentimes use different EMRs to the acute care setting EMR. The result is that they send to the physician still following that patient stacks of faxes every day for them to sign. Not only that, they have no secure way of communicating quickly and easily with a provider team when there are problems with those patients after discharge. So they call up, they leave voice messages, and they wait for a call back. And it's during this time that patients often bounce back as readmissions. Wellbeam tackles this problem by integrating with the EMRs across both sides and bridging clinical care workflows across care teams. Wellbeam's superpower? Not only are we EMR agnostic and therefore truly interoperable in a way that most EMRs are not, but we, unlike a lot of EMRs, also put providers at the heart of our designs and design clinical workflows that are really and truly suitable for patient care and care coordination workflows. Excited for you to follow our progress and our impact on reducing readmissions, driving new billing codes, and saving a ton of provider burnout.
I'm going to take you down the accelerated sequential antidepressant protocol. So I'm accessing this through my EHR, and I'm a primary care physician who has a patient coming in with depression. One thing that I have access to is the medication library, where I have a quick glance at the 7 essential meds that I need to effectively treat outpatient depression. I click on any of the green links. I can see the titration, side effects, even the FDA label. Let me hit close. More importantly is if I have my visit type, so the patient's coming in for the first time, initial management, and let's say I already have the PHQ-9, so I don't need to use this calculator, and instead it's actually going to be plugged in directly from my EHR, that I have a PHQ-9 between 5 and 14. My next step is assessing the suicide risk. If my patient hits passive suicidal ideation, I get a little note that they're okay for outpatient treatment if they have support. I do a bipolar screen. Let's say they're negative. And then let's say they're 23 years old. So over here I get a reminder of a black box warning of increased suicidality. I warn my patient about that, and I get my first step, sertraline or psychotherapy. I can click down for more details on which one to give, and I can even click on my assessment plan, which can auto-generate a note that can then be populated inside the EHR.
Hear in their own words why they should win.
My name is Yair Saperstein, and I am the CEO of AvoMD, where we make clinical guidelines into actionable decision support at the point of care. As a clinician, it's impossible to stay abreast of 100-page clinical guidelines, and electronic health record alerts are often ignored, with 98% dismissed with no further action taken. This knowledge challenge has led to billions of dollars of wasted healthcare spend and medical errors. Our solution, designed by a team of doctors and informaticians, transforms clinical evidence into interactive, actionable decision support, allowing clinicians to practice medicine more confidently, hospitals to reduce unwanted inefficient care variation, and patients to receive high standards of care consistently. We have a SaaS model for healthcare organizations, partner with medical societies as content partners for free, and partner with industry supporters for sponsorship of our content, allowing for a win-win of stakeholders. Our superpower is that our no-code builder tool enables institutions to build, edit, and update their decision support in real time without needing IT resources or programming knowledge. Our software can also integrate into the electronic health record or work completely standalone on web and mobile. In randomized control trials, usability studies, and live customer implementations, the software has been shown to improve ROI across important quality, workflow, and financial dimensions. RCTs demonstrate AvoMD can improve diagnostic accuracy by 20% and that our solution improves ED delays and patient flow while reducing inappropriate admissions. Our traction is growing. Over 300% user growth last year, 4 times increase in our content library. In the past few months, we signed agreements with the AAFP and AHA, Mount Sinai, and AstraZeneca. Our long-term vision is to become the universal, adaptable, and next-generation platform for clinical decision tools and content with coverage across multiple care settings and specialties.
I'm Amit, the VP of Commercial Operations for Fathom. As you are all aware, health systems are facing widespread staffing shortages, an issue that is even more acute on the administrative side. In a recent survey of revenue cycle leaders, over 30% cited operational deficiencies because of labor shortages as their top concern. This is even more problematic with coding, because if charts don't get coded, claims don't get out the door and they don't get paid. And with the current interest rates rising, those AR days are only getting more expensive by the day. Over the last 5 years, Fathom has combined an extraordinary data set of over 400 million coded encounters with cutting-edge advances in deep learning AI to build a coding automation solution that is, well, comprehensive. Depending on specialty mix, Fathom can do anything a coder can. Anywhere between 70 to 98% of all encounters can be auto-coded, reducing headcount requirements by over 70%. It's very accurate. All Fathom's clients see 10 to 40% reduction in coding errors. Further, Fathom catches work performed that is often left uncoded, ensuring full reimbursement. It's lightning fast. All coding results come back in 90 minutes round trip. Lastly, it's highly scalable. Fathom codes over 20 million encounters, and counting some of the largest revenue cycle operations in the country as current customers. The future of revenue cycle is real-time and transparent. Fathom is the key to that future. Thank you very much.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.